Well, John and Christelle, some cities and states have set up forms to help people self-report the outcome of their at-home tests. But in Missouri and Kansas, there is currently no way for someone to report their test results, meaning there could be hundreds or even thousands of more positive cases that we don't even know about.
If you walk down the aisle at a local pharmacy, you probably wouldn't find any of these waiting for you. The at-home tests come in handy when fighting the coronavirus, but can be a headache when tracking cases.
Very likely we are seeing an underreporting, which is difficult to think about because our numbers are higher than they've ever been.
Right now, there is not a system in place for people in Kansas or Missouri to self-report their results from an at-home COVID test. Health departments say part of the reason is because results from an at-home test are considered suspect cases.
It's difficult for us to verify the specimen. Was it collected in the proper way? Somebody said they tested on themselves. Did they actually test somebody else?
Some at-home tests like BinaxNOW have self-reporting systems in place. The CDC and local health departments encourage people who are positive on an at-home test to get a second opinion from a healthcare provider.
Your doctor then knows the proper process to report them to the state and to the local health authority.
Working for you, we reached out to health departments in our area to see if they are working on a self-report system. Johnson County told us it's in the process of establishing one. The other said the best way for people to get their information out there is to call their doctor and/or the local health department. Leaders say the at-home test may not be a perfect system, but it definitely comes in handy.
Even if that person doesn't do the follow-up test, even if they just stay home and they isolate appropriately and they let their close contacts know, and then those people get tested, there could be a real domino effect to them preventing transmission of the disease.
And health leaders say if your at-home test is positive and you choose not to get a confirmation test, you still need to isolate at home and let anyone you were in close contact with know that you likely exposed them. Coming up on Fox 4 News at 6, I'll share an estimate of what the true infection count could be when you add in at-home test. John?